Robin Berzin. I'm the CEO and founder of Parsley Health, and I'm going to talk to you a little bit today about what we do, and I'll bring it back to autoimmune disease because it's something that we address every day, all the time, and is one of our key clinical focus areas, along with gastrointestinal health, cardiometabolic, psych, and fertility and hormone balance. So this is actually my office in New York City. We're the only medical center allowed and present in WeWork. We now have centers in New York, San Francisco, and Los Angeles, and we're in WeWork across the board. WeWork does not allow medical services, but they allow us because they believe in our model and what we're doing and how we're really transforming the user experience of primary care end to end. So I'm going to talk a little bit about why Parsley is different, and first I'm going to talk about the clinical factors, so why the medicine is different. So I'm a conventional MD. I went to Columbia for med school. I trained at Mount Sinai Hospital in New York City in internal medicine. But I always believed in a more holistic approach, and I found the field of functional medicine, fastest growing field in primary care. Cleveland Clinic, #1 hospital in the country, invested over $60 million in a functional medicine center at the end of 2014. As their CEO, like me and like many of us, believe that we need a new model for primary care. Today in the US, about 1 in 5 doctor's visits is a primary care visit, and in other countries it's 4 out of 5. So we've really marginalized our primary care doctors to sort of be dispensaries for medications and referrals to specialists, and unfortunately that's not working so well because we have chronic diseases like autoimmune skyrocketing. So our medicine is different because we look at your health biography. We care about your family history, but also whether or not you were born C-section, have had antibiotics throughout your life, whether your disease was triggered 2 years ago when you went through a divorce. We understand that the social determinants of health, which is well documented in medical literature, are far more important than genetic determinants of health. So we look at your social ecosystem, including your diet, your lifestyle, and mental emotional factors. Our initial visit's 75 minutes. Which is pretty radical. And we know everything about your life story because I can't take your symptoms right now and just triage them and try to manage them with a drug or a quick fix. What people need is a holistic 360 solution. And then we test hormones, toxins, microbiome, and genetics. We use cutting-edge testing that your primary care doctor probably won't be using for another 10 years because we have to understand how your body's functioning, not just what the specific, micro problem is today. And I'll get more into that in a second. Oh, sure. Okay, well, I'm going to have to refer to that, unfortunately. So. And then our interventions are much broader. So while I prescribe drugs and order tests, I also prescribe nutrition protocols, professional grade supplements, lifestyle and behavior change, and then of course medications and referrals to specialists where appropriate. And then the testing is really personalized. So we're interested in getting to the root cause of your problem, not just band-aiding your symptom with a drug. And so we do a lot of really cool, what I call to my patients, fancy pants testing that Nathan knows a lot about. And we look at your cortisol profile over the course of the day, because perhaps why you're not sleeping and why you've been prescribed that Ambien is the fact that your cortisol is elevated at night. We look at your genetics and understand basic things like MTHFR status and how that might impact your likelihood to respond to an SSRI, how certain nutrients like methylated folic acid and B12 might help you make more serotonin, dopamine, and norepinephrine, and how that might help you lower, or in many cases at Parsley, we're able to get people off of the litany of somewhat useless psychiatric medications that they've been thrown on by a primary care doctor who, while well-meaning, never went on to manage that care and never went on to sort of help the person get beyond just using a medication to actually resolve the root cause of their anxiety or depression. We do stool analysis looking for yeast, inflammation, dysbiosis, which is an imbalance in the good and bad bacteria, which we now know our bacteria educate our immune systems deeply. So we know that medicine starts in the gut if your digestion's not healthy, if you have intestinal permeability, parasites. All of these things are impacting your immune system, and we look at that. And then we have a functional age profile that we look at, including things like inflammatory markers, blood sugar, vitamin D status, other things that we know actually are more indicative of your functional age as opposed to your chronological age. And then My attitude was, I co-founded a health tech company called Curator that's gone on to do quite well a few years ago. Back when I was in med school, it's HIPAA compliant GroupMe or messaging for hospitals. And that was kind of my first foray into the digital health world. And what I thought then, back when I was a medical student in Columbia, and what I think now is that your medical care should work the same way as your iPhone works. It should be convenient, seamless, where you are. We should be bringing medicine to you, much like Doctor on Demand is doing so well. And so for us at Parsley, everything's mobile optimized from the beginning. We're video in-person agnostic for the most part. I believe video is just a feature of medicine, so it's part of what we do. We're 100% open note. You can see all of your records and data online, upload and download anything. We really put the patient in the center of our care, and this year we're moving forward to build an end-to-end platform that visualizes somebody's entire health biography in a way that they can master with their providers online. And then the last thing I should say is, this morning, I don't know if you guys were upstairs and heard about hierarchy in medicine and how much that can kind of create bad decision making, right? That was her point, someone from Stanford Business School. And we really believe in a flat architecture at Parsley, so we have health coaching as part of our model, and health coaches and doctors work as teams with the patient. Everyone's on equal footing. I can create a perfect plan for you as a physician, but if you go home and don't do any of it, well, it's not that terribly useful. And then the model. So, all of this, at least to me and most people I talk to, feel like this is just how medicine should be. Like, I hear that all the time. And yet it's not. And so the world that I come from, having practiced functional medicine, observed functional medicine, is typically doctors who practice this way with this high-touch interpersonal care. They're not only not using tech typically or using data, they're often solo providers because they've kind of left the reservation of conventional medicine and said, hey, I want to do things in a different way, but to do that I have to be off on my own. The other problem with them is that they're typically $1,000 plus an hour. So when I worked in a medical practice in New York, typical, beautiful, amazing functional medicine practice, I was the cheapest one in the office at $650 an hour, and I couldn't afford myself, and all our patients were hedge fund billionaires. And I thought that was interesting, but that everyone deserved access to this. And so right now, while Parsley is certainly not quite ready for the lowest socioeconomic demographics, although we're actually working with the former CTO of Health and Human Services to make that happen, we are currently $149 a month, all-inclusive, something like a direct primary care model. And that has opened up our care and the kind of care that we offer to many more people. And if we look at the millennial generation, about 12 million of whom already are making over $100,000 a year, they don't trust the healthcare system, they don't want conventional doctors, they are dealing with problems like hormone imbalances and infertility and digestive issues, and they're not even going to see the doctor until something gets really bad and they need to go to urgent care, and they're willing to pay for experiences that align with their values. That's where Parsley sits really nicely, because we are not only a healthcare service, we're the only one that's also an aspirational lifestyle brand. And so all that's awesome, but who cares if you don't get results? So we've lowered prescription drug rates by 700%. The average primary care visit results in a prescription drug 69 to 70% of the time. Ours are we're at 10 to 11%. We are obviating the need for IVF and IUI, so we've already helped 20% of our members with infertility overcome that. Women today are shuttled down a pathway of IVF and IUI without anyone looking under the hood, understanding why their hormones are imbalanced, why they're not getting their periods, and why they can't get pregnant. And through our process and our relationships with our patients, we're rectifying that. And then less utilization of specialists. So if I solve your acne, because your acne is just because you are allergic to dairy and you're still eating it and you stop eating it and it goes away, well, you don't need your dermatologist anymore. So there's so many ways in medicine where we funnel people towards specialty care, which then topically, literally, tries to band-aid a problem when the root cause is a dietary or lifestyle imbalance. And we recognize that. We also recognize when somebody needs to see a specialist. I always tell the story, to bring it back around to autoimmune, of one of my patients, 24 years old. She came to me, and she had Behçet's autoimmune vasculitis, which results in ulcers all the way from your mouth down your GI tract. And she had been fired by the top rheumatologist at Cornell in New York because none of his drugs, none of his biologics, steroids, anything were working. And so he said, well, he kind of threw up his hands. He didn't have any more tools. She came to see me. We changed her diet. We put her on a gut healing protocol, which helped kill off some of the parasites she had and also reconstitute her microbiome. We reduced inflammation. We helped her with stress reduction. In 6 weeks, her ulcers completely went away. Her autoimmune disease has gone into complete remission since then. And it's all through using a functional paradigm. So we don't always have perfect results like that, but so far, with our sickest patients with a symptom score of over 100, we're showing average reductions of at least 45% in overall system-wide symptoms. So we're seeing amazing results, and people seem to also like it. So our NPS scores are super high, and our retention rates are great as well. People are clamoring and calling for new ways of interacting with their doctor, which everyone up here is doing an amazing job of creating and providing in their own ways. And Parsley is doing that too. Again, we are open in New York and Los Angeles with physical centers. San Francisco center will open in about 2 months with an incredible medical director. And we are also providing nationwide and even global care. People see us the first time in person, and then everything after that is virtual. So we have patients now all over the country and the world, Italy, Uruguay, Israel, London, and look forward to having ultimately global coverage. Thank you.